Obesophobia is the fear of gaining weight. It's most prevalent in adolescent women, but men can have it too. Like all phobias, obesophobia is a type of anxiety disorder. Phobias involve an intense and irrational fear of a specific object, place, or situation. If you have obesophobia, talking or thinking about weight gain makes you feel an exaggerated sense of anxiety. You may also experience overwhelming dread around situations associated with weight gain. If you are afraid of gaining weight, you might go to extreme lengths to avoid it. This increases the risk of developing an eating disorder, or it could be a sign that you have one. Obesophobia doesn't have a clear cause. It's likely due to several factors, including weight stigma, perfectionism, anxiety disorders, personal experiences. Weight stigma is the practice of judging people based on their weight. Weight stigma generally discriminates against people with overweight or obesity. As a result, it can cause certain individuals to develop a fear of gaining weight. Perfectionism, like weight stigma, may be related to pressure from friends and family. Some individuals might also have a genetic tendency for perfectionism. Obesophobia might stem from social anxiety disorder, which involves a fear of social rejection. You may be scared of gaining weight because of society's attitude on weight gain. Obesophobia could be due to your personal experiences. If you've been teased for your weight or appearance, you may associate weight gain with negative judgment. This can make you afraid of gaining weight. Obesophobia could also make you do certain things to avoid gaining weight, such as fasting, obsessively counting calories, exercising too much. The main complication of obesophobia is an unhealthy obsession with body weight and food. This increases the risk of developing an eating disorder, which is a serious condition characterized by dangerous eating behaviors. Some types of eating disorders involve obesophobia include anorexia nervosa, bulimia nervosa, purging disorder. People with anorexia nervosa have an intense fear of weight gain. They also may think they are overweight, even if they are abnormally underweight. But anorexia nervosa doesn't simply involve a problem with food or weight. For people with this condition, extreme dieting and losing weight are ways to deal with underlying emotional issues. Due to the severe lack of calories, anorexia nervosa can lead to serious complications like muscle wasting and multi-organ failure. Bulimia nervosa involves recurring episodes of binging and purging. Binging is eating a lot of food within a short period, often without any control. Purging is getting rid of the extra calories with one or more unhealthy behaviors, such as forced vomiting, excessive exercising, using laxatives or diuretics, fasting. There isn't a formal test that diagnoses fear of weight gain. However, as a type of anxiety disorder, obesophobia may be identified by a general practitioner or a mental health provider. To determine if you have obesophobia, a provider will do a psychological evaluation. They might also ask you questions about your symptoms, evaluate your eating behaviors, analyze your medical, psychiatric, and social history. If they think you have an eating disorder or believe you are at risk, they will likely recommend treatment. Obesophobia is mainly treated by a mental health provider. The goal is to manage your fear of weight gain and reduce your risk of developing an eating disorder. If your obesophobia is part of a diagnosed eating disorder, treatment may involve a similar approach. The most common treatment is cognitive behavioral therapy. This may involve recognizing distorted thinking patterns, changing unhealthy beliefs, learning positive habits. Normally, phobias are not treated with medication, but if your doctor thinks your obesophobia is related to an anxiety disorder, they might prescribe anti-anxiety drugs. This might include antidepressants, antipsychotics, mood stabilizers. Since anxiety and eating disorders often co-occur, you may also receive medication if you're diagnosed with an eating disorder. If you enjoyed this video, subscribe, like, share, and comment.